This video is intended to demonstrate the steps involved in evaluating an embalmed cadaver's heart for pathology. It is intended to accompany the cadaver's heart PG laboratory guide. After removing the heart from the cadaver in which you have dissected, be sure to ask your instructor whether it is okay to section the heart before proceeding. The heart may have been cut during dissection activities to allow for the viewing of ventricles and atria. You can still proceed with the evaluation steps, but be sure to pay particular attention to the organ's orientation during sectioning. The first step involves weighing the heart to check for whether the organ is in a normal range. The laboratory guide has a chart for male and female normal ranges. Next, you will need to evaluate the coronary arteries for clinically significant blockages. For this, you will need a scalpel. Starting at the origination of the coronary arteries, transversely section the vessel to evaluate the patency of the lumen. Here, you can see a close-up view of this heart's right coronary artery after sectioning. You can see that the vessel's patency varies from the proximal portion on the far left to the distal portion of the vessel on the far right. The left two sections have approximately 50% occlusion from what appears to be an atherosclerotic plaque. See the laboratory guide for more explanation about blockages of coronary arteries. A blockage greater than 75% is considered clinically significant. Continue to evaluate the left coronary artery, the anterior interventricular artery, the circumflex artery, and the right coronary artery. Record any significant blockages. Now, you will need a long knife for sectioning the heart in a transverse plane, starting at the apex. Your cut should be at 1.5 centimeter intervals. At first, you will see the left ventricle and then both the left and right ventricle. Continue sectioning until you are just inferior to the atrioventricular valves. After sectioning, you can now evaluate the myocardial tissue for thickness and its gross appearance. You can use the laboratory guide to assist you in identifying the gross appearances that are pathologic. This specimen has concentrated white discolorations that are indicative of collagenous scarring within the myocardium. A complete description of the scarring process is included in the laboratory guide. It is usually an indication of a healed myocardial infarction. There is no way to tell how long ago the myocardial infarction occurred. After examining the myocardium, you should take a few moments to examine the heart valves for pathology. The atrioventricular valves can be checked for prolapse, and the semilunar valves can be checked for post-inflammatory thickening and calcification. This aortic valve and aorta has moderate calcification. But the pulmonary valve is normal. Use the laboratory guide to compare the valves of the heart from your cadaver to images of these pathologic incidences. In addition, etiology and clinical background information is provided in the guide for each condition.